This presentation will give you an overview of the PiLR Health ecosystem. I'll use a split screen with the presentation on the left and the PiLR Health cloud platform on the right to give you an overview of some of the system's basic concepts. PiLR Health automates a lot of study project management tasks. It also makes it possible to collect data from mobile sensors and to combine that real-time data with data from reference datasets. PiLR Health also supports the use of R as an analytical tool and all of the R packages, of which there are about 7,000. PiLR EMA is a mobile app that acts as a programmable data collection tool that you can use in a research study. PiLR Health has editors that allow you to configure PiLR EMA so you can create sophisticated data collection tools without programming. PiLR EMA can present surveys to participants as well as gather background sensor data and forward that back to the cloud for analysis. Let's take a closer look at some of the key concepts and features of PiLR Health. Participants may be in one or more groups. Project may have one or more groups, and one or more projects may exist in an organization. The system has a template concept that combines settings from various project components that give you the flexibility to manage complex project setups. Template consists of an EMA config, which are the surveys and associated triggers, an instrument and its settings, and a time period, which we refer to as an epoch. Once you start using PiLR Health to set up a project, you're going to need to know your way around. So let's talk about a couple of the key navigation icons. The gears will take you to the project settings, and the dashboard will take you to the coordinate page. Project settings help you get your study set up, and the coordinate page is used to manage things once you're underway. Let's take a closer look at setting up a project. To do that, we'll select the gears icon and go to the project settings page. There are three main phases to project setup: managing the project components, setting the project design, and dealing with overall project administration. The project components menu allows you to add things like instruments, in this case PiLR EMA, dashboards, you saw an example of a dashboard earlier, files, data sets, and other electronic assets that are useful to you in your study. The project design menu allows you to do things like set the duration of an epoch, create and configure templates, and set up groups. The project administration menu gives you control over who else has access to your project. So you can create team members and control what access they have. You can see what participants have been added to the project, and you can control new registrations. Let's review a couple of project setups to see how these pieces might fit together. This first study has a relatively straightforward two-group setup, control and treatment, and we're going to be looking at the data to see whether the two groups do differently. We can do this using one instrument, one template, one epic, and just define two groups. Fairly simple to do in the setup. The second study is a little more complex, as we have two groups in two phases, and we're going to vary their treatment in the phases. As you would expect, this setup's a little more complex, as the durations of the two phases are different, so we need two epics. We still only need one instrument, and we're going to have several different templates which we assign to the different groups. But all of that can be set up in advance, and you end up with all of the work happening automatically during the study itself. And remember, we've allowed you to use mobile sensors to combine that with reference data to schedule activities for the participants, all without doing any programming work.